recording, so I don't have to tell them. Hey, good morning, everyone. I'm so excited to be here this morning. I have with me here, gosh, let me get my notes here. I have Dr. Debbie Ozment. She has been in private practice dentist in Oklahoma City since 1985. She has completed a medical school master's degree in metabolic nutrition in 2017. I want to share real fast too before I get into this. Hey, you guys, if you don't mind, hey, Dr. Samara, thanks for jumping on live,
yeah,
you guys.
hi.
Hey, everyone. Just going to back up here a little bit. If you are watching the live, if you will put hashtag live, if you are watching the replay, if you'll put hashtag replay, give us some love hearts here for Dr. Debbie Ozment. We're going to just, two women sharing our passion, our stories. And so I'm going to read a little bit more of her bio. Thank you guys all for jumping on, and I'm just excited to be here with her. So I'm going to back up here. She had completed a medical school master's degree in metabolic nutrition in 2017, and is a nationally certified health and wellness coach trained at Mayo Clinic, one of my favorite places. She has been an active blogger since 2015 and speaks nationally on vitality-related lifestyle issues. She is committed to early diagnosis and intervention of oral disease to positively affect not only the mouth but the entire body. Dr. Debbie and her husband Mike have two adult children, Samuel and Micah, and son-in-law Chris. She enjoys hiking, art, and gardening. Hey, well, I'm just so excited to be here.
Thanks,
so
Wendy.
I want her, we're here at her office here today in Oklahoma City. And like I said, we are just here doing this to empower other women to know what's out there, I want to just spotlight Dr. Debbie here today of just her passion and what she's doing here in the Oklahoma area with health and wellness. And I just kind of just share a little bit more about you, Debbie, and why is this your passion?
Oh, Wendy, you are inspiring me today. This has been thrilling to spend time with you. I've been in practice since '85, so in 1985 we sort of treated the mouth like it was this separate piece of the body, and we, as dentists, we were very much trained as carpenters. So we're excellent carpenters, but
that's a good.
Yeah, we really are. I mean, we just work at a really small scale with a person attached. But then, and I have a very small relational practice. In fact, our children were here with me for their first years, and would ride their tricycles down the hall, and it's just been really fun. But consequently, I don't have a big boom, boom, boom practice. I really like to know people, and dentistry is unique in that you get to see people on regular intervals for years. Mm-hmm. So I've had generations, at one time 4 generations in the same family.
Wow,
so you see a lot of trends. So I've called it my front row seat. Mm-hmm. And because you see a lot about life, people share a lot, as you know. And so I started just seeing people's medicine list getting longer, and then I started seeing side effects from these medicines, which most pharmaceutical drugs have dry mouth as a side effect. And once a person gets on several of these medications, their mouth becomes the Sahara Desert. So they can take good care of their teeth for years and years, spend a lot of money, spend a lot of time, do things right, but when their mouth starts getting dry, they start getting rampant decay. We've always done everything very by the book as far as gum health. So we do what's called a comprehensive periodontal exam once a year on every patient, but I didn't see a need to do that exam 30 years ago on people in their 20s, really, because they never had any problems. But that's all changed. That's all changed. I'm seeing seeing gum disease in actually teenagers, and it's shocking. It's shocking. So although I have a very astute population of patients, I've still seen their health span, the healthy lifespan, decline. But then I started noticing, okay, people that do these lifestyle measures, people that are active socially, serving somewhere, people that are not drinking a lot of sodas all day long, people that have activity in their life are experiencing fewer problems, and they're taking less medicine, so they're having better dental health. And then conversely, Wendy, the people that have gum disease, I started noticing they have all these other problems. So you just start seeing these correlations. I mean, as a healthcare person, you become an observer of people, and it's just so fun and so interesting, and people are so willing to tell what's going on and to try to seek help. So I just want to help people. I just want people to feel better, because I've seen that it's really those simple things. It's not always spending a lot of money that results in the big changes. It's really mindset. It's really a change in mindset, just like you have. Your radar's up for what is going to help me. Your radar's up for no, that's not good. That long term is a bad decision. So I think that's sort of been what has fueled it.
So, one of the things that we were talking about before is that, Coca-Cola companies and other these companies are in your face all the time, especially in the, I just feel like, literally, Oklahoma is actually, for the unhealthy, we're number 46 in the most unhealthiest city in our state in the United States. And that's just sad.
Which is crazy, because in health span, we have a lifespan, and the lifespan is about 79 years in the United States, and then health span is only about 69 by some recent estimates, maybe even like 65.5 years. So that gap in there is the time when people are waking up and saying, what doctor do I go to today? Where's my medicine? I don't feel good. They're not really living out their God-given purpose. They're not feeling good. And so I so agree. I've been afraid to, say too much. I mean, I really try to not say anything unless somebody asks me, to not give unsolicited advice. But I forget. You're right. Everybody's being inundated with all of this, the real thing or whatever it is to feel good, get your own bag. I mean, this highly addictive food that is what's causing that.
It is. There's processed, everything's out there on the news, and things like this are on, everywhere you see. It's in our face. It's in our children's face. But I just feel like as healthcare professionals and stuff that are more preventative, we have to be more in your face.
We do.
Because the stories have got to be told. I just feel like, we've talked about it. The Lord laid it on my heart. It's just tell it. Go tell the story. Get the stories out there. And people will listen. And they need other people being able to let, because I didn't know what was available. I didn't know like dentistry. I didn't know, that you looked at, the mouth. I'm sitting here when I'm reading your thesis and everything too, and I read, oh my gosh, and actually Debbie too is getting in September, right?
Yeah.
She's going to be on TEDx Talk, and that's so exciting.
That's so exciting.
I was like, I can't wait to hear it all.
Thank you.
So one of the things that I read, let's see, go back to my notes here, is that I love this. The mouth may possibly be the canary in the coal mine for the body.
Oh, thank you. You love that. Thank you.
I'm sitting here going, oh my gosh. So just talk a little bit about that. I mean, that's like
in the old days, the miners would take a canary down into the coal mine, and these canaries were teeny and inexpensive. But if the canary stopped singing, then they knew they had to get out, because the air quality. I mean, there's probably poisonous gases in the air. So it was just a really easy way to save a lot of miners' lives. And what I've seen over the past 35 years, and even especially since I've gone back to school and done this research, and found saliva tests to actually check for the bacteria in the mouth, that indeed what's happening in the mouth can be an early warning sign of what's happening in the body. For example, so many times before I went back to school. So I felt like I had to go back to school, Wendy, to get credentialed because I found this medical school program that had a master's degree, and they were sort of like, "You're a dentist, why are you here?" But then when it was all over, then I wrote The Forgotten Orifice was my thesis, and they were like, "Oh, Debbie, no, you're doing The Forgotten Orifice." But
it's so amazing. I love it. I'm sitting there just going like, oh my goodness.
If anybody wants a copy, we'll figure some way to get it to you. But thanks. But it was so fun. I mean, it's just research. It's not any big brainy thing I did. I just got, it could have been, it was an avalanche of material. It could have been 5,000 pages. The research is there. And for example, there was a great study done in 2012 where they had 20 people who had died. 10 had Alzheimer's disease, dementia. 10 had perfect cognition when they died, and they all were about the same age. So in the brains of the people who had Alzheimer's disease / cognitive problems, they found that 40% had a bacteria in their brains that only is found in the mouth. And the people that were all mentally clear still had none of those had any dental bacteria. Now, the thing about it, we thought these, just stayed in the mouth, but we know they affect every single part of the body. So if you can get rid of those before problems, I mean, Alzheimer's disease is a disease that there's no real treatment for, and we say there's no prevention, but I really disagree with that. If we can do things early, could greatly decrease your chances. But you can't wait. You can't wait. You can't wait to get out till you've seen that canary dead for. You can't wait to start leaving until the canary's been dead for a day or two.
Right.
And you gotta be aware of the signs. So the mouth really is, even with type 2 diabetes. Before I went back to school, I would see people who came in and their gums looked pretty healthy, not healthy, and so I just started, saying like, hey, you need to get your blood sugar checked. And I'll bet, I mean, you could just sort of see these things. And I'll bet 90% of the time, indeed, they were developing type 2 diabetes. It's a joke around here that I'm the first person that knew somebody was pregnant, because pregnancy causes changes in how the gums look.
See, gosh, you just never even think about that. It all ties in together. I know with Dr. Alana Samara all the time at New Life Medicine, she was like, look at your fingernails. Let me look at your fingernails. Let's look at your tongue. Let's see what's going on. It all connects.
Yes.
It all connects. And it's just like, God was so intelligent when he made us, and it's just like, look at the whole person and the individuality of the whole person of what's going on. You can't just go in, and put a Band-Aid on stuff and just overlook what all other things are going on, from your gut health to, you look at now they're seeing, from, just not having vaginal births, of not having that gut health anymore. I mean, it's like, not, moms not being able to nurse their babies and things like that. They're knowing that that's some long-term things that you need to start looking at, taking some serious looks at those things.
Exactly, and even things like daily bowel movements.
Yeah.
So now, after all this, it's your teeth are fine. Tell me about your bowel movements.
Yeah, exactly.
And so
we're talking your poop now.
Yeah, and this matters, and people are so really grateful to talk about it, because they're like, okay, can we? Yes, we can talk about this. We can go on my, whatever you want to do, because it all is a signal. It's all, there's so many canaries that we like you said, put a Band-Aid on things, and we don't listen to the signs, the God-given signs. The way we're designed is miraculous, and our bodies are designed to heal. We just have to give them the right ingredients.
Give it the right ingredients. It's really sad that so many times when I will be talking to someone about something healthy, about preventative, and they go and they start researching it like crazy, and all of a sudden, I don't know, but then it's like, they're not researching that processed food, or they're not researching those sodas that they're giving to their children, or, diet stuff. And it's like, oh, you guys, research that. You really, something that God gave you, these natural things for us to use, greens. It's like I always say, just get your greens
exactly. Well, and like I wrote, write my blog. I've kind of taken a break, so getting ready for TED, but. There for a while I was writing my blog post 4 times a week. So for 1 year I wrote about real food. It totally changed what I was doing. I mean, I was eating good, but when you find out that what is in a fig, for instance, I never ate a fig before that.
I had no idea what figs were.
If I want something sweet, now I have a bag of figs sitting on my desk because it's so delicious. And you know that what's in it, you can't get in a pill. You can't get a supplement. You can't, this real food.
It's real food.
Is synergistic, way more than we can ever comprehend. We think we know so much, but God's put it on the food.
Yeah, God do it. And even too, I learned of dates. I love dates too, and figs are like so big. And someone like, oh my gosh, that's so much sugar. And I'm like, let's see, our brain needs some glucose. There's some things that, but it's real. The fiber, there's so much. Exactly. It's so healing, knowing of parasites. There's so many things that God knew what he was doing.
It's satisfying.
It's satisfying.
I used to keep Oreos. I used to keep a bag of Oreos in my car seat.
That's my weakness right there. My husband brings any more Oreos and he's like...
But, but then when you start eating real food, you don't even crave them anymore because that is so satisfying.
Yeah, it is.
Really,
it is amazing. So good. So let's see here. So we've kind of talked about the importance of nutrition and inflammation.
It's so interesting.
Can we just talk?
We can talk about it because so much of it starts in this forgotten orifice. I started, learning, say, 10 years ago about C-reactive protein. That's this measurement on your blood test of chronic inflammation. It's another thing, Wendy, that inflammation's good when it's healing and goes away. I say it's sort of like that relative that comes and stays. You have fun for the first day, but then when they start moving their stuff in, then you kind of go, this is chronic inflammation.
Yeah, this is not.
This is like chronic inflammation. Yeah. So
that's good. I love that.
I started seeing these kinds of things, and would send people to the doctor for whatever, and then learned about that number. Then doctors have started sending patients here if they have high C-reactive protein. Well, normal, you want it to be 1 or below. If you see it on a conventional blood test, it will say 3 and below is normal. But really, to be optimally healthy and vital, vitality, like Wendy is teaching you about every week, you want it to be below 1. Well, recently, a physician sent a patient who had a C-reactive protein above 20. And so we did our saliva test. We can test for like 11 bugs, and sure enough, it's all there. So after just some pretty basic dentistry, not surgery, not really invasive big stuff. She got her blood tested, and her C-reactive protein was down to 4. Now that's still not exactly where it needs to be, but that was a heck of a drop because the physician said, Debbie, if you don't find anything, we're going to start testing for lymphoma. So that was the next step. And so it was really fun because chronic inflammation, of course, is the basis of the top 10 causes of death and disability. It could be argued that it's in all of those, even including maybe suicide and depression, because there's a very big chronic inflammatory component of depression. But for sure, it's maybe not in accidents, but that's the only one that that really...
I was going to say, it's just we see so much. I think there was like on time, it's like this big inflammation person, or whatever, and talking about that, and now it's starting to get out there, but people are still like, what do we do? What do we do for it? What do we do? And so that's what we want to share. It's about preventative. It's preventative. It's got to be. We have to be speaking of preventative and not so much the treatment and everything else. So one more thing, a couple things here actually. So we've talked about, have there been any obstacles that you've actually faced with more integrative approach with your dentistry and everything?
Yes, there are. For one thing, I'll ask someone, say, about their blood sugar and kind of start that conversation. And they'll say, well, this is not what my doctor told me. And so that was, of course, a red flag to me. And I say, you listen to your doctor. You have to listen to your doctor. I am not a physician. I do not diagnose. I just want to educate. And so that's why when I found this medical school master's, that was really important. I still don't diagnose, but there's wonderful physicians like Dr. Samara that take a lot of time, but my heart goes out to physicians who don't have a lot of time to talk to people. So it is up to individuals to become educated, to find people that have quality information like you're providing, and to become informed. Other obstacles are insurance, because here we spend a lot of time with people. We can't be an insurance-based office. I don't have time to. I couldn't do that if I was insurance-based. I'm not insurance-based, so that's an obstacle, I think. And let's see. And I guess another thing, Wendy, may be that people have to be open.
Yes.
And sometimes people have to have experienced pain, and that. That is hard.
I got chills because it's so hard. You don't want them to
experience pain, but until they're an open receptor, until they're wanting the information and ready to intentionally, maybe change some things they're doing, there's nothing you can do.
Yeah,
you can. One of my professors I went through this, before the master's, I went through a fellowship in anti-aging medicine. And one of my professors there said, you can love somebody to the end of the earth, but you can't make them healthy.
That's so good. Yeah. And you just want to, because you just, it's almost like I'll give all these things away and I'll give all this information away. And until, it's just, it's so true. And it's just like, so you guys get it.
Yeah, share it.
We're not going to go hunt you down and love you all the way.
Yeah. Don't give, advice that people don't ask for, because relationships are the prime thing.
Yeah.
But live it, and then I think people will ask.
I think that's the biggest thing. Walk the talk, live it.
Yes.
The more that you can even share these videos, share the information, so that people can get out, so that they know. That there's other people out here that are trying, to educate and make a difference and try and, people want to help. People want to help. If you're struggling with health or anything.
And you won't just feel better.
Yeah.
I mean, it translates into more vitality, better sleep, better relationships. You feel better, but also an interesting thing, I needed to re-up my life insurance. And so the guy that was selling me my life insurance said, now there is this premium group it's cheaper if you really are healthy, but nobody gets it. You won't get it. I mean, so at 59, I did all my stuff, and I got the cheapest rate because I was in this really. Now, I'm not bragging. I'm just saying that I don't think I would have gotten that at 49. I really don't. I mean, I was living active, basically, trying things, but as you get educated, as you listen to Wendy, you get your why. And then I don't feel like I'm missing anything to make sure I take a walk this morning. It just felt so great. And, you make sure you just change a few things. And you have your why. It's not like, I never feel like I used to get a bag of Cheetos and just eat them till they're gone. I don't even want that anymore. Yeah. My wanter has changed. And I think that's what education
your taste buds and everything changed. I mean, I was just talking to someone the other day. I don't remember who it was, but I was just like, my body was craving some greens, and I had some butter lettuce just cut up or whatever, and I had some cilantro in there, and I had some parsley. I just pick it up out of the bag, and I'm just shoveling it. And my husband comes in, and he goes, "What are you doing?" You just listen to what your body is needing, and your whole taste buds and everything change. I can't imagine without a smoothie, and I love intermittent fasting. And things like that is just so key and so vital for your health. And it's like, God knew. I mean, it's like you go through all these things. It's like, God, you're so smart.
And you just feel good.
You do. And your family wants. I mean, I've seen the difference in my family asking me. It was like, okay, now what do I do for this, or what? And if I wouldn't have experienced what I went through with my health and making the changes, so many of my family, I can see my dad. He was on blood pressure medicine, all kinds of different things. And, he's off all of those things now. He made those changes. And he just said, I'm going to do this because he was inspired too, just with seeing what I had went
Wow.
through, and said, so you never know who's watching. You
That's
never
a
know
great
whose
point.
kids are watching. I have my son's children, friends will be over and stuff, and it's like they're asking questions, and they're wanting a green smoothie, and they're like, oh, this is great, I want a green smoothie. So you never know who's watching.
No.
You just never know,
No.
and so I think that's one of the most important things too. It's just like be, just step it up.
Yeah.
Just step it up sometimes.
It really reaches into eternity because you probably read in the paper just the pregnancy outcomes that happen as a result of a lot of this oral bacteria, like low birth weight and preterm birth. And I mean, if you can prevent those, you can prevent a lot of potential problems for that child. I mean, it's really so much bigger than this day.
It is. It's so much bigger. So, you guys, I love every bit of it. We could stay here and just talk for hours,
so
I promise. I was like, okay, we're going to have to do this again with Dr. Debbie because she's so just a wealth of information. So, you guys share this. Like I said, hit the replay, get it out there as much as you can for this information. And, gosh, let me see. Is there anything else that you can, just real quick, one more thing, just advice for a woman. We're really touching on women and women in the Oklahoma area that's standing out and making a difference. So if someone as a woman wanting to come in and say, hey, I want to come into nutrition or something else and more the integrative, I'm not against Western medicine, but just different.
Integrating the best of both worlds.
Together, what would you say would be your biggest or top advice?
I would say go for it. Be unafraid.
Yeah.
Find people that are like-minded. I think we need more cohesiveness. We all have a lane. And I'm just like, Lord, show me what my specific calling is, because there's just room for all of us. We all speak to different people. We all have different levels of experience. We all need each other. I think we really need to seek out each other. I think we need as much education as we can get to separate the hype from the real healing. And be unafraid. Keep trying. Start somewhere. That's my blog name. Start somewhere.
Start somewhere.
Start somewhere. That's the key.
Somewhere.
It's really, don't be afraid. If you don't know everything, don't be afraid. Just start somewhere and find people that do. Connect with quality people like Wendy, and just start learning and start integrating it into your own life. I think that's the very best thing when other people see changes. People always worry about weight loss, but really weight loss follows all of these good habits.
Exactly.
It's the natural thing, and you don't have to have some crazy diet or anything. It's just get started yourself, and people are going to ask.
Exactly. That's so good, because it is, people go, and I know that's a hot topic, weight loss. It will follow. It will follow. When you turn your body's everything back on to heal itself, the weight loss and everything just follows. And I think I love that. Just go for it. You got to start somewhere. I love that blog. Thanks. So start somewhere.
Wellness. Start somewhere. Wellness.com.
Yes.
And I hope that you can watch the TED I don't know how we make the paper available. But if anybody wants to know about the forgotten orifice, I think it is. I appreciate you saying that. I may be able
to put it on one of the comments and stuff. I will comment with Debbie's information and everything else, and hopefully we can try to get that more out in case I can just go in. So if you guys have any questions, even in the comments, we'll try to answer any type of questions that we can. And so we just hope that you will give lots of love on this live video and share. We just hope that you will, and we're just happy you guys are all here with us today, and thank you so much.
Thank
Debbie.
you.
I just appreciate it so much. You guys, I don't have my clicker, so I'm going to have to come up here and push finish.